Welcome to Cancer Talks with tumor tamer Rajeev. Dr. Rajeev Vijayakumar, a seasoned medical oncologist and a hematology specialist, is known for his ethical and cost-conscious leadership in cancer care and bone marrow transplant. Hello, doctor. Thanks for doing this series for us. Last episode, we covered quite a bit of questions, doctor, and with that, we have more questions flowing in this time.
Nice, I like that.
So we'll start off with that. Okay, the first question is, what are the signs and symptoms of rare types of cancer such as pancreatic or liver cancer? Can these cancers be detected before formal diagnosis is made? Now, these questions are being asked by caregivers where patients have come in stage 2, stage 3, stage 4, and they've had no symptoms whatsoever so far. So they're like, how did this even come? Because generally cancer comes in, I mean, you know it before like 4, 5 years, sometimes 10 years is what they were told. So we're just wondering.
That's very interesting. So it's like, again, I like to give some small anecdotal stories before that. So it's like, let's consider you have some terrorists attacking a particular city, or dacoits attacking a city. When they're actually traveling into the city, they're treading very cautiously. Before they can cause damage, one of the dacoits, the junior dacoits, who's not very adept at doing dacoitry, he trips onto one of the electric lines and cuts off the electric supply of the city. What do you think is going to happen? Everyone's going to wake up and be like, what happened, why happened?
Yes.
Do you think the dacoits can enter in at that point in time? They would again step back.
Right.
And then after another scenario wherein it's like how we just saw the bomb blast is how Khamenei was terminated. There was a bomb kept 2 months ahead, expecting when he's going to come inside, and then afterwards the Mossad exterminated him.
Right.
So therefore, where it was all well planned and kept inside. So you see the difference.
Yes.
No one even had an inkling that he was having a party half an hour earlier. With a lot of friends, and then afterwards everyone went up in smoke.
Right.
So that's how it. So the tumor also works in a very similar fashion. If you have the tumor, when it is growing, if it affects any particular important structure like a nerve, then the pain emanates. Once you have pain, you will immediately seek medical attention. And if it is small, then you will go. But if it is, let's consider if it has gone slowly crept into your system that you are even unaware of it, then only when terror strikes, when it's like when the apocalypse happens, do you even get a whimper as to that it has actually set in and it has already come in. Right. At that point in time, when you actually open your eyes, it's too late. So therefore, in pancreatic cancers, if you have the tumor, so the pancreas is like a organ. It is like an umbrella's handle.
Right.
So you have one head of pancreas, then you have something called uncinate process, which is like a C shape. Then you have body and the tail of pancreas. So if there is a tumor occurring in the head of the pancreas, it would block the common bile duct. So the common bile duct, ladies and gentlemen, is like pitta, which we say pith. So therefore, from the drainage from the liver, it enters through that. So if you have a tumor sitting there, even half centimeter, 1 centimeter, it might block that drainage. Once in your house, if a drainage is blocked, the toilet's filled with filth. Similarly, if the drainage is blocked in the liver, you get jaundice. If you get jaundice, you will immediately go to the doctor. Right. Then you check it out, you'll find that there's a small tumor sitting there. Chop chop, disease cured. If you have the same tumors sitting in a different area, like in the tail or in the body or in the uncinate process, then what happens? It grows to the size of a cricket ball, and then it grows so strong that it starts doing its all dance. It starts sending cells, mercenaries all over. Then you have tumor going all over into the tissues of the abdomen, into the liver, into the lung, and once the patient starts coughing, then you will go to the doctor, identify that there is some fluid in the lung. Then the doctor would scan the abdomen and identify that there is a fluid in the tummy, and then afterwards the liver is studied, and then you will find this one very small little fellow sitting there on the pancreas, the size of a cricket ball, like one papa prani. And then afterwards you will realize that that's how it happens. So it's unfortunate that it happens that way, but if you're lucky, you will be able to identify it faster. So it's not your mistake or anyone's mistake that they have not been able to identify. This is a common pain point which patients come, sir, did I miss out anything? Should I have done something else more? Could I have found out earlier? Is it due to my lack of knowledge, my ignorance? I wasn't taking care of my wife. I wasn't taking care of my father. I wasn't taking care of my mother. I wasn't taking care of myself. Is this the reason why this has happened? So this is a common question. Actually, answer is no. It is how nature has devised that particular disease. In sense, if it is there on a pain structure or some drainage structure, it comes to light immediately. If it is there elsewhere, then after it grows, it percolates into the system. Only then do we get to know. So therefore, if that answers a question that why these diseases are diagnosed at a later stage rather than earlier, like especially pancreas, etc. Even prostate cancer for that matter. Prostate cancer also, it is not that anyone who has difficulty passing urine, we call this lower urinary tract symptoms, LUTS. It's not that everyone who has a prostatic problem will develop a cancer, and not that everyone who has a cancer is going to develop that difficulty passing urine. It's only in the later stages. You know what is the most common symptom with which prostate cancer patients come to us? Back pain. And why is the back pain? Because the tumor has gone all over the blood, gone into the bone, eaten the bone, and the bone is causing pain. Therefore, it is that stage where you're able to diagnose. Then the patient is absolutely fantastic. He might be just going on a bumpy road, like from Hoskarehalli to Kengeri, and then one nice auto, and then one nice pothole would have gone there, and then he'd be like, Yamma, my back is paining. Then he would have been like, okay, fine, I'll put Amrutanjan and go away with it. Then it won't go, then he will go to his GP. His physician will be like, Enilari, Gaudre, Sumneri, Anta Hebuto, on the painkiller. Then after he will again not come back, then he'll go to an orthopedician. Orthopedician will be like, I will take X-ray. Sumne X-ray togoltira doctor, they would say. Then they will be like, okay, we'll get an X-ray. And then so on and so forth, an MRI. Then afterwards they will come to us. So it's not the patient's fault. It depends on where the tumor arises. It is, they say, right, the right place, the right time. It is something similar to that.
But I'm glad to know, doctor, and this is for both the patients and the caregivers, a solace that it is not your fault to have cancer.
Correct.
It is not your fault. You just can't get to know when it starts and how it starts. With that, we go to the next question, which is a little different from a regular question. How to detect cancer in animals?
Papa Prani. This is very interesting actually. The first time I actually heard this question was when my teacher, Colonel Tyagi, sir then became brigadier, then he became General Tyagi. He was a surgical oncologist in Army Hospital Research and Referral when I trained there. So what happened was one of the OT days was blocked on a certain afternoon. So then we were wondering what, and then the anesthetist was mumbling and tumbling. I don't know how to give anesthesia to this, what to do, how to do. And then there's a lot of hush going on. Went inside and then after they asked what happened. Then they were like, Tyagi sir has brought in his pet Labrador. I'm like, oh, he likes to bring his dog to the office, to the hospital. They're like, no, he's gone to the OT. I'm like, what is he going to the OT? Is there something missing? He wants to find a missing person? Like, no, that dog has a tumor in its pancreas. I'm like, what? How did he diagnose this? Same thing. He blocked the bile duct, the dog got jaundice. So he took it because sir is a officer, took it to the thing. They were like, Jai Hind sir, scanned it, found the lump on the pancreas, and then afterwards, then who's going to operate on a doggy? Now you have your oncosurgeons for human beings. Who's the oncosurgeon for doggies? Very, very few people would do that. But then sir said, that's okay. If I can't do it, no one else can do it. He took his doggy into the operation theatre. Then afterwards, he said, call the anesthetist, who was a veterinarian, who took his help, gave anesthesia to the doggy, and then afterwards, he opened up, removed the tumor from the pancreas, chop, and when all of us knew that we were wondering how he did that, he said, I just went up, spoke to my friends, pick it up, nothing is difficult for a Indian Army soldier. He told that, knocked it off, gave it, and then afterwards he's like, Rajeev, by the way, this pancreatic cancer, what dose you want to give for the dog? I'm like, let's check its body surface area. Well, it's different that the poor doggy did not come up for chemotherapy, so therefore I got saved. Otherwise, I would have had the stress of trying to give chemotherapy, human beings chemotherapy to a dog, and then keeping my fingers crossed as to that the dog doesn't die. Yes. Imagine if it dies, he's going to shoot me. He's an Indian Army officer. Well, for dogs do get, and any animals do get, I think in my recent trip to Kumbakonam, where I saw that when I was giving bananas to a nice beautiful elephant, it had nice rangoli on its hair, tusk and all that, we were giving it, and then the pukari, that is the flower, the lady who sells flower, she said, no sir, I will not sell the banana if you're giving it to the elephant. I'm like, what happened? Sugar sir, sugar, the elephant has sugar. I'm like, how did elephant get sugar? It's full sugar cane sir, fully eating sugar cane, that's why sugar for it. I'm like, how did you know? They put injection, they give insulin sir before every meal. I'm like, it's gone to this level. So then after like, sir, before that, so if you want, I will give you leaf. You put 10 rupees, it will give you blessings. You take and go, sir. Don't give banana, ginana. So I'm like, okay, fine. So that's when I realized that even animals get the sugar, diabetes and hypertension. I'm sure we don't have cuffs to measure the blood pressure of an elephant, but nevertheless, at least we got to know that I learned that elephants get diabetes as well. And of course, a lot of, I've seen 2-3 cats also having tumors. It's different that we didn't know what to do with it. Right. The pet owners were distraught naturally, but well, we just had to let them go.
Sorry to hear that. Well, so it's not just humans, it's also animals getting cancer, and it is not new or unheard of. Okay.
We could actually make a web series on animals getting human diseases and see how they're getting treated.
We should try that out. Okay, with that we have to move on to the next question. Why do oncologists say that cancer is still growing when there are no lumps present in your body?
Oh, it's not just oncologists. Everyone will say that. Now you tell me, in your city, do you have crime going on? Let's consider there is no crime as of now. Does it mean there are no robbers? There are no dacoits? There are no thieves? Are you going to wait for them to say that, okay, fine, only when they commit a murder, commit a molestation or a rape or a dacoity, then are you going to believe that those guys exist? No, right? Similarly, you have lot of these tumors which are sometimes like sleeper cells, sometimes active, but they're not, it doesn't come to our attention. It's just they're around there, hanging around there, it doesn't come to our attention. So therefore, this question is actually very pertinent for when the recurrence of tumors, like a patient says that, they say, sir, breast cancer, it's a stage 3. Sir, I've operated. No, sir, I did PET scan, sir. I'm like, who asked you for PET scan, man? No, sir, my friend told PET scan means you'll identify everything, it seems. I'm like, what everything, it seems? They're like, so I did PET scan, sir, there is no disease. I am free of tumor. I'm like, okay, by the way, but Mr. Madegaudre, you need to take chemotherapy for this. Why, sir? Why should I take chemotherapy? PET scan done for my wife, nothing is there. See, it works like this way. Once you take the tumor is removed, small cells, it's called circulating tumor cells, they're floating all around. Okay. So they go and they would seed wherever there are fertile lands like lung, liver, bone. Mm-hmm. From there, they would again start growing. So therefore, with a lot of research, we have identified and a lot of studies that let us just operate and leave these patients, let's not give them chemotherapy. Realize that a lot of patients were coming back with disease. Then they realized, what should I do then? Let's give some chemotherapy and see after the surgery. So my ancestors, that is around 30-40 years back, after surgeries of breast and different cancers, they started giving chemotherapy and realized that, areva, large percentage of them did not get the cancer back. And then some people started realizing that there are some people having toxicity of chemotherapy. Then they said, let's not give 20 cycles of chemo, let's give 8 or 10 cycles. And so on and so forth. Then it was like this in the market. One fellow will say 4, I will say 8, then 7, then 5, then okay, Namdula, 6 cycles. So that's how it came down to a normal thing that 6 cycles of chemotherapy almost for most cancers, some 4, some 8, some 12 as well, but 6 cycles more or less. It gives you a good amount of cell kill. It's something called Gompertzian curve where cell kill keeps occurring, the number of cells reduces to a very, very low extent. So therefore, there are sometimes what we do not see also exists, like Wi-Fi, fragrance of a woman, intelligence. Right. So, and then afterwards fear, all of things, it's not visible, but it's all existing. It's all existing. So something similar to that. You know what? Now let's come to apart from the jokes part, the scientific part, what are the number of cells required for cancer to manifest as a 1 centimeter cube? 1 centimeter cube means like one small goli gundo. It's like the size small marble. What do you think is the size? It is 10 to the power of 9 cells. That means to say that how many is that? Like 100 million? I'm not bad at math.
Yes.
Don't make that much money, so I don't know how much of that zeros it adds up to. So it's like 10 to the power of 9 cells of tumor cells are required to form 1 centimeter cube. And guess how many cells are required, cancer cells are required to kill a patient? 10 to the power of 12 cells. That means 10 to the power of 9 becomes 10 to the power of 10, 11, 12. He's done. He's reached the pearly gates of St. Peter's, or his Ram Nam Satya Hai, God knows. That's how. So therefore, that's the only space that you have between identification of the tumor from 1 centimeter cube till the tumor becomes killing so big that it kills the person. So when it becomes 10 to the power of 10 cells, the patient starts manifesting symptoms, and that's when he seeks treatment. So that time gap that we have is actually very minimal. From 10 to the power of 9 to 10 to the power of 12, it doesn't take too much time. So it is like if you take x-axis, y-axis, it's like a lag, logarithmic increase. So therefore, here you identify the cell, and by the time it's here, patient is dead. So you have only that much amount of time. So therefore, it is important for us to intervene at correct time frames. Only then you will be able to effectively treat the patient, prevent recurrence, save his life, and allow him to have an enjoyable and long life.
That is a lot of hope, Doctor. That is a lot of hope. Thank you so much, Doctor. With that, we come to the end of this episode. If you have questions on cancer, or you know anybody who needs help with cancer, feel free to reach out to Dr. Rajeev on the WhatsApp number 7975301470. I repeat that, it's 7975301470. We will make sure that your questions are answered in subsequent episodes. Thanks for watching.